Good day, my name is Shannon Mutungan from BSN 1B. Today, I am going to demonstrate the blood pressure taking. So what is blood pressure taking? It is a pressure exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. Purpose: to determine the vascular resistance to blood flow and also to determine the effectiveness of cardiac muscle in pumping blood to overcome the vascular resistance. Equipment: blood pressure apparatus, sphygmomanometer, stethoscope, paper, and pen. Procedure number 1. Identify and explain procedure to the client. Rationale: to ensure right procedure is done to client and gain the client's cooperation. Good day, ma'am. My name is Shana po, ma'am. What is your name, ma'am?
Aslaya po.
Ma'am, Aslay, check ko po yung BP niyo ngayon, ma'am, ha?
Opo.
Next, assess the client's physical status. Rationale: to ensure that the client is rested and to identify the affected side of the client. Ma'am, may masakit po ba sa inyo, ma'am?
Wala naman po.
Ang ulo niyo po, nahilo po kayo?
Hindi naman po.
Next, determine the client's baseline blood pressure. Rationale: for comparison of results during monitoring. So, kanina umaga po, ma'am, is ang BP niyo po is 120/80. Ma'am, so BBP ko pa ngayon, ma'am. Next, assemble the equipment. Rationale: to promote the efficiency of the healthcare provider. Next, wash hands. Rationale: to decrease the transfer of microorganisms. Next, place client in a comfortable position lying or sitting and position the arm at the level of the heart with the palm of the facing up, preferably using left arm because it is nearer the heart. Rationale: this position places the brachial artery on the inner aspect of the elbow that the stethoscope disc can rest on it conveniently. Having the arm above the level of the heart causes a decrease in BP. Next, wrap the deflated cuff evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. For an adult, place the lower border of the cuff approximately 2.5 cm or 1 inch above the antecubital space. Rationale: pressure in the cuff applied directly to the artery will give the most accurate reading. Next, wrap cuff around arm smoothly and solidly, not too loose, not too tight. Rationale: a smooth cuff and wrapping procedure equal pressure and give accurate reading. A cuff too loosely wrapped will give inaccurate reading. Next, estimate the systolic pressure. Palpate the pulse of the brachial artery. Inflate the cuff and note the reading when the brachial pulse disappears. Then deflate the cuff. Rationale: to prevent the underestimation of the systolic pressure or overestimation of the diastolic pressure. Next, wait for 1 to 2 minutes before making further assessment. Rationale: to prevent false reading. Place stethoscope earpiece in your ears and close screw valve of the air pump. Rationale. Sounds are heard more clearly when the earpiece flow on the direction of the air canal. Next, palpate brachial artery, tear valve clockwise to close and compress valve to impalpate cuff to 30 mercury above points where the palpated pulse disappears. Rationale to get accurate results. Next, release the air in the cuff slowly so that the pressure goes down at the rate of 2 to 3 mercury per second. Rationale. If the air released too slowly from the cuff, there will be congestion in the extremely causing pulse reading, and if it released too rapidly, sounds may not be heard and accurate levels. Listen to the sound first. Distinctly loud muffling sound is systolic pressure. Continue to release the air evenly and slow. Last soft muffling sound is systolic pressure. Rationale to get accurate result. So after the final sound has disappeared, deflated cuff rapidly and completely to release the remaining air from the cuff and prevent congestion in the extremity. Roll the cuff and place it in the case. Wipe the earpiece of the stethoscope with antiseptic swab and out of in its proper place. Rationale. This method of removing dirt prevents possible cross-infection of the ears. Next, wash hands. Rationale to prevent the transmission of microorganisms. Next, evaluate the nature of the blood pressure. Rationale to compress from the baseline data. Next, record the result taken. Rationale for monitoring purposes.